Hello, everybody. Welcome to our webinar hosted by the American Public Human Services Association, or APHSA, in partnership with CURAM Merative. Today's webinar topic is supporting families and programs with purpose-built child welfare solutions. Next slide, please. My name is Alex Claremont, and I'm a senior content writer at APHSA. I would like to take a minute to share with everyone an overview of APHSA and the work we do for and with our members. APHSA is a membership organization that represents state and local health and human services agencies from across the country and through their top level leadership. Next slide. We aim to deliver for our members through three core channels: influencing modern policies and practices with the goal of strengthening communities, building capacity through our conferences, technical expertise, publications, and OE consulting practices, and connecting members across a wide circle of stakeholders in the health and human services sector and with key partners. Next slide. Next slide. Speaking of connecting members, I invite you all to save the date for our next APHSA conference being held this year. Our Information Technology Solutions Management, or ISM conference, has been combined with our annual Attorneys Education Conference to form the ISM APHSA Expo and Conference, being held from September 10th to September 13th in Kissimmee, Florida. In addition, our Staff Development and Training NSDTA Conference will be in Pittsburgh, Pennsylvania, from October 22nd to October 25th. Check back on the APHSA website for more information on each of these conferences, including when registration opens. So, just some light housekeeping items for this webinar. During the presentations, we're requesting that you put your questions for presenters in the Q&A panel rather than the typical Zoom chat feature. If possible, panelists will try to answer questions during their presentation, but there will also be time left at the end for questions. This webinar is being recorded, and it will be shared with all registrants in the coming days. Now, it's my pleasure to introduce the moderator for our panel discussion, Marcy Tatch, General Manager, CURAM at Merative.
Thank you so much. Thank you all for being here, and it's wonderful to be part of this esteemed panel and discussion. I wanted to tell you a little bit about CURAM by Merative for a few minutes, and then I'm going to introduce our esteemed panel, which I know is going to make this discussion just a wonderful use of everyone's time today. So first of all, CURAM has over 25 years experience helping national, regional, state, and local governments transform the delivery of social services, empowering caseworkers, and helping individuals and families access the services that they need to achieve better outcomes. Our experience has us allowed to develop technology that can impact the future. Our solution is built specifically for social work professionals, helping them increase their efficiencies, improving job satisfaction, and overall giving them the tools they need to have a positive impact. Like all of you, we are passionate about applying technology to build healthier, safer futures for children and families, as well as the entire communities. We are proactive in our work, always looking at the bigger picture and implementing human-centered design principles to help transform systems. We work streamlining multi-program eligibility and administration programs, all the way through modernizing child welfare programs. We'll be sharing examples of our technology as well as the amazing work our clients have been doing in the field at ISM next month. I would love to meet all of you. We'll be at booth 509 if you can stop by. Now I want to introduce our wonderful panelists. We have three outstanding experts today to drive our conversation. First, Carolyn Hussey. Carolyn is an HHS market strategist with over 20 years experience helping state and local governments plan and leverage technologies to improve their outcomes of their operation. Next, Rachel Carrick-Brunker. She is a child welfare consultant. She started her career as a caseworker and eventually found her way as a role of CCWIS product manager at the state of Illinois. Most recently, she's been working in the private sector, helping states implement technology solutions to align best practices with desired outcomes. Lastly, Bill Myers. Bill is a government health and human services industry consultant from Merative. He is also a former child welfare caseworker, integrator, and administrator who has led teams with software implementation projects across the United States and Canada. He will share firsthand experiences, shedding light how technology advancements have made a significant difference in the field. Thank you all for being here today to discuss this very important topic of innovation and how programs can improve the outcomes for children and families. With that, I'm going to pass this over to Carol to kick us off.
Thanks so much, Marcy. Appreciate those remarks. Before we dive in today to our conversation about technology, we wanted to start first with a polling question. I see so many familiar names in the participant list there, so thank you all for coming. And so we're going to put up a poll here just to get a gauge of how many years you've been working in child welfare programs, whether you're a government agency or vendor, doesn't matter. If you could just put your number of years of experience in the box there. Just gives us a bit of a gauge of where we're at. Okay. Do we have some answers coming in there, Liz? All right, well, we're gonna move on from that. And before we dive into our conversation today, we're going to spend a few minutes, and if you could just advance to the next slide, please, David. We're going to spend a few minutes talking about sort of the national landscape of challenges and trends, things that we're seeing in child welfare programs today, some of the issues that have been emerging in the last couple of years. The first thing that is probably obvious to everyone on the phone are the issues that every agency is facing across human services, but probably more so in child welfare than others, is the issue around workforce. And that issue is multi-pronged, right? We have an issue with recruitment, with retention. We have an issue with just the resiliency of the workers in child welfare, and things like secondary trauma and the types of things that are sort of unique to child welfare programs that perhaps other agencies aren't facing. And those issues have a domino effect on all kinds of things downstream, right? So if we have a major turnover issue, for example, somebody still has to do that work, and that work goes back to the workers who remain. And so we're seeing caseloads, go up. And what happens when caseloads go up? Families aren't getting perhaps the type of service and the quality of service that they need. We're introducing risks to children. We're compromising our regulatory compliance. So there's this huge snowball effect that happens with the workforce issue in child welfare. The other thing is just this notion of sort of moving upstream. You see FFPSA prevention there. We listed those items separately because there's certainly the aspect of FFPSA and the use of 4E dollars to fund some of those prevention services. Many agencies are going beyond that and doing a lot of other sort of prevention and community collaboration and other pathways that lead to that. But those are, impactful as well to an agency, right? We're introducing new types of processes, new practices, new stakeholder collaboration, new regulatory requirements. So those are big impacts. There were certainly some very early adopters with FFPSA and some others that have had some challenges in getting this implemented and being able to leverage those funds. And so we'll talk a bit today about how technology can enable some of that. The next thing that we've been seeing and feeling more challenged with perhaps in recent years is engagement with all of the stakeholders across the spectrum of child welfare. And with that, we're talking about families, of course, bio families, as well as foster families, kin, and older youth, right? Those youth who are about to transition out of the system, and how we stay connected with them and help them be connected after they're sort of transitioning out of the traditional child welfare care. And then that other universe of stakeholders. So that could be everybody from providers to children family or child family team meetings and the other folks that are involved in helping to support our families while we're working through some of those challenges with stabilization and just giving them the supports that they need to keep the family intact. How are we engaging with them? I shared with my fellow panelists that I was speaking with someone in a state who leads an independent living program there, and coming out of COVID, she had nothing but great things to say about the engagement with their older youth during that COVID period, and how being able to engage with them remotely actually increased their engagement, and how that allowed them to be more connected, more available to services, and that many of those older youth were actually advocating for themselves in a more vocal way, in a more frequent way. And so these are the types of things that we want to continue to encourage and expand on. We will touch briefly today on issues around equity, and we'll talk a little bit about that from a couple of different lenses and how child welfare can address some of those issues. In terms of what we're seeing, obviously, is the access to services, availability of services where people need them, and of course, the issues around racism and bias. And so we would certainly not have a conversation about trends in child welfare without addressing that issue. And then obviously the big one that we'll be talking about today is CCWIS. And CCWIS has been around for a while. It was first announced in 2016. If you can believe it or not, 6 years ago, the final rule was written. So we are 6 years down the path, and we're still trying to figure out what's the best way to modernize, our systems, but to support modern program and practice and all those other things that I just spoke about, right? So we're going to touch on all of these things today in a bit more detail. Just kind of wanted to lay that framework there. If you could just proceed to the next slide. And we see here, what does purpose-built mean? And you're going to hear that term a bit today. And when we talk about purpose-built, before we begin to talk about technology, we have to talk about the program, right? And so what are the aspects of program where we can perhaps leverage technology to provide improvements in all kinds of things, right? We're going to talk about today efficiencies. We're going to talk about the engagement that we were just talking about, cross-program collaboration, stakeholder engagement, solutions that actually make it easier for a family, for example, to manage their case plans and things like that. So we're going to be coming up with many more examples that you'll see today. We do have a poll question there as I'm talking, if you want to look at that. How well is your technology working for your agency? Be honest. Many of you are still, unfortunately, probably, using technology that may be decades old. And it's okay to say, you know what, it's not working for us today, because when that technology was built, it was built for a different reason, right? It was built primarily at that time to satisfy federal reporting requirements. That was really a big piece of the CCWIS requirements. And so now our practice has changed. We have, this focus on prevention and getting upstream, which Rachel's going to talk a little bit more about later, and Bill. And then, that collaboration, those whole systems of care and social determinants of health and things like that. So the technology that we need to support child welfare programs and operations today really require a lot of different considerations. And so we're going to be talking about what kind of technology does it take to help advance those programmatic and operational goals and strategies that you all have developed for yourselves in your programs. Next slide, please. So I mentioned technology considerations. And so when we begin to think about how technology can support modern programs, it's very natural to want to sit down and list out all the requirements that you need to replace what you have, right? We're going to talk a lot about that in a little bit. But what you really need to do is kind of step out of your current way of work, right? And really sort of rethink that and consider it from these lenses, right? We talked about the workforce issue. And so we're going to discuss how really, even when we were preparing for this session, you can't really categorize or bucket client experiences without talking about caseworker experiences, because there's so much overlapping that goes on there. Interoperability with CCWIS. There are required mandatory data exchanges, and then there's some optional ones. But we don't just check the list and say we have an exchange because we put it on our automated function checklist. We want to understand, how does that interoperability help us from a process and a program standpoint as we're designing those exchanges and creating MOUs and doing all of those things, which leads to data. Right? I don't think I've worked in a state where I haven't heard them say, geez, I'm really concerned about my data. You are not alone. And so as you're embarking on this new world of CCWIS, that's something you want to think about early and often. And so we'll talk a bit about that, because you can't have a great exchange if you don't have great data, right? And you want to equip, we talk a lot about data-driven decision-making. We want our workers to feel confident and trust the data so that it helps inform their decisions. Another thing that comes up a lot that we see in RFPs, and we'll talk through today, is this notion of COTS versus CRM. What's the difference? All the labels, it gets fuzzy sometimes. And so when you think about identifying your solution right out of the gate, certainly there are reasons why states choose to do that, right? Because, there's some value in standardizing across the enterprise and things like that. But there's also gives and takes with that. And we're going to spend a little bit of time talking about COTS. For those of you who are new to that term, commercial off-the-shelf software, purpose-built, that's what Cúram is. Purpose-built for a particular program, whereas a CRM, which is a customer relationship management platform, you'll hear that term platform a lot, which is also a lot of times misused or used in a variety of ways, because COTS can also be a platform. But the platforms that you're seeing in the market, many of those are not purpose-built. They're more generic in nature in terms of they could be used in a variety of programs. And then you sort of configure and build those out to your specific needs. So that's the big difference that we're kind of focusing on in part of our conversation today. And then the final consideration, from a technology perspective, is CCWIS compliance. You don't have to be CCWIS compliance. That's certainly a decision for you to make. There's obviously a financial advantage to being CCWIS compliant in that you will get potentially, for some aspects of your system, up to 50% funding from your federal partners to build that out and to become compliant. And we won't get into it too much today, but at ISM, I'm facilitating a couple of sessions around CCWIS compliance, the use of self-assessment tools, and all of those things, because CCWIS compliance is much, much different than it is in other programs. It's not just a checklist, right? The big thing that ACF is looking for with CCWIS compliance is the fact that you are fulfilling the promise of CCWIS by building a solution that supports your program and practice. So it's not just about the features and functions that you are implementing, it's producing evidence that shows that that feature or function leads to a programmatic value. And so obtaining CCWIS compliance is not an easy feat, and it's not something that happens the day you implement your system in many cases. So that's another kind of misnomer out there, is that I'm going to implement my system and it will be a CCWIS compliant system, and no state has done that yet. So that's just to know that. But those are sort of the technology consideration. We're going to, get into a lot of this today. And I'm very eager to have this dialogue with my co-panelists, Bill and Rachel. So I think that's the last slide before we open up our conversation here. And so with that, I'll invite Bill, first of all, to kind of talk with me a little bit about, this notion of getting upstream. Right. I mentioned prevention, FFPSA, I said getting upstream, but can you tell me, from your perspective and as a former caseworker, what does getting upstream really mean to you?
Absolutely, Carol, and thank you. So when we talk about getting upstream, we're really talking about preventing those conditions that will lead to neglect, or in a worst case scenario, abuse. So we've learned that this means preventing poverty and bias, as well as focusing on equity to strengthen families, as you noted at the outset. I heard recently from a former colleague who said that families who are receiving economic and medical benefits, so things like SNAP, TANF, Medicaid, they're less likely to be involved with the child welfare system. So to be able to do that, we need to require some collaboration across these siloed programs, the siloed policies, the siloed funding, to really get to that unique mix of services that we need to keep families stable. So as we do that, families can move toward economic mobility and being able to thrive in their communities. So as far as having to do that, we also need to break down any existing barriers to affect the changes needed to develop this new service delivery structure. So having a technology solution like Cúram that comes out of the box with both a health and human services specific data model, as well as an integrated service delivery, will really help accommodate these policy and practice changes.
Yeah. And, that can sound really overwhelming, right? When I think about all the different social determinants of health and all the different programmatic needs that any one person might have, they're being served across these programs and the silos that you mentioned. I think sometimes when you think about the magnitude of that, it can sort of paralyze you to not proceed, right? So what would an agency do? Where would you start in beginning to make that journey? Because that's not going to happen overnight.
No, certainly challenging, Carla. Like anything, we need to take it one step at a time. So you start with one program, you collaborate with their leadership for the good of those families that are common across the programs. And then you work together with other programs to develop the shared processes, shared communication channels, shared service delivery models that will keep this work family-centric. So then with your families, you really want to ensure that they don't have to tell their story over and over again. So this will be able to empower them to manage their own activities and really give them the opportunity to have both voice and choice. So at this point in time, caseworkers and their families, they're more comfortable than ever with using technology. So we should really use that to accomplish our end goals. So having a solution like Cúram that at its core includes those end-to-end child welfare processes to support case practice, it's a great starting point. So as you said, Carol, we don't expect this all to happen overnight, but it certainly can happen a little bit at a time.
Mm-hmm. Yeah. I agree. And I love, that you use the phrase like family centric, right? Keeping the family at the center of all we do, not asking them to tell their story over and over and over again. A lot of that goes back to the data we were talking about earlier and, how we're engaging with them, empowering them, reducing the workload on the worker. All of that is related and intertwined, right? All right, Rachel, so based on what Bill just described, what we've been talking about and my, context setting at the beginning of our session here, can you talk a little bit about, how technology can enable that prevention and cross-programmatic system of care that we were just talking about?
Sure. First of all, in terms of, accessibility, we want to think about the accessibility of information. So allowing, families to have access to agency information, what services are available through portals, things like that. A lot of our families still, I mean, even in this day and age, don't really know exactly what's out there, you know, what they qualify for, things like that. So the accessibility of information and using tech to share that information. Also, you know, the cross sector collaboration. You know, often families that we serve have you know, engagement or service from multiple human service entities, right? And so connecting those service providers for that family, like, you know, a lot of us in child welfare, you know, the child and family team within the agency, but we need to broaden that to the family's community, because that really needs to be their community of care. I mean, that's ultimately what prevention is building a support network, a community, and helping families, you know, reach success and well-being, and then sustain that. You know, I think I say this a lot, in maybe it sounds trite, but you know, it's going to sound simple. I know it's not this simple, but if we think about it this way, if we do put the family first, or we begin, you know, with the end in mind, when we think about, you know, getting upstream, that really means that we have better outcomes for kids and families, and, you know, kids, youth, and families, right? So if we're giving, if we're enabling tools that support engagement, support, you know, increase protective capacities, have, you know, information that families need to be successful, to find the supports that they need, we're arming them, you know, with the things that all of our family, we need those things as parents, as, you know, so then you kind of get it right by the workforce, right? And then compliance just comes next. It's like the other, you kind of flip it. It's like the other way around. So yeah, and I mean, obviously the obvious things are mobility and portals, but like, if you think about that, there's so many possibilities with mobility and portals, right? Thinking about how the family has access to their case, that's inviting them into their own story. Like, why, you know, why wouldn't we do that? I had someone say this to me not too long ago. Imagine, you know, using your banking app, but you can't see your bank information. I mean, we got to start having those kinds of conversations too, and thinking about it that way, unpacking it that way, you know, and really making it real for our workforce. So we're not just talking about technology, we're talking about a change in how the whole world is doing business, including us, right?
I love that. Yeah. And that's actually a great segue too, because I wanted to kind of move into our workforce discussion next. And I think we have another poll that should be coming up too, about what is your most persistent operational challenge in child welfare, and your programs and your operations. So, you know, if it's a technology issue or a process issue, you know, what are the things that really sort of hold, you know, a worker back from being able to be a social worker, being able to do the work that they signed up to do? Because as we're going to, you know, continue to talk about here today, technology should make their jobs better, not harder, right? So with that in mind, Rachel, let's talk about actually, I had this question for Bill. I apologize. So the traditional approach, you know, is simply to just hire more caseworkers, and we are really in a crisis level situation here now with workload, with workforce, and in many jurisdictions, you know, because child welfare workers have to have certain levels of education and certifications and training. You can't just go hire anyone to do this work. And so in some jurisdictions, they've already tapped the resource pool of workers, right? They've already come and gone. And so there's just no one left to hire. And so our traditional approach of just go hire more people is not working, which is partly why we're seeing some of these big vacancies, right? So if the traditional approaches are no longer working, Bill, what are some other ideas that we need to be thinking about in terms of addressing this workforce issue?
Absolutely, Carol. As a starting point, like you said, there's a lot of reasons why just hiring the new people isn't going to work. So in some cases, those jurisdictions, they've exhausted their pool of workers that are available to do this type of work. As you noted, it often requires special education or training, let alone the passion to do this work, which can be extremely challenging at times. We've seen caseload numbers increase and practice models have changed. So workers are more and more impacted by stress, by secondary trauma, and even burnout in some cases. So a lot of states are seeing significant turnovers with workers quitting in droves. Adding to that problem really is states are having a tough time finding the replacements for these workers. So that's resulting in long-standing vacancies. We've heard about some jurisdictions reporting 50%, 50+% vacancies or more. And the work itself isn't going to go away. So it's assigned to the remaining workers who are still there. So unfortunately, we can't hire our way out of this any longer. So agencies are really having to come up with creative solutions related to workforce resilience. The first thing that states tend to look at is increasing pay, increasing wages, but that really doesn't get to the root of the problem. So we've seen some interesting things happening nationally, such as redistributing work to different roles, moving to shift work, hiring outside of the state, job sharing, using technology to limit travel, as well as other unique models. So as we all touched upon previously, we really should be taking advantage of the caseworkers and their families' comfort and expectations around technology. Give them the tools so they can ease this administrative burden and have them spend more time in the field. So time will really tell if any of these approaches will have long-lasting positive effects, but there's definitely a lot more that can be done from this perspective.
Mm-hmm. Yeah, definitely a lot of creative things happening, and I'm definitely enjoying seeing that. One thing I mentioned it when we were preparing for this session too is in one state that I talked to, they are actually hiring former clients to help staff the hotline or to do other things. So we start to look at work, redistributing the workload, redesigning the work, and who does the work. There's so many ways in which we can carve this up in a new way. Bill, toward the end, you talked about, technology as a support, a way to address some of these issues. And we talked a little bit earlier about operational efficiency. So Rachel, as the former product manager and, also caseworker, maybe you could give some more specific, I wanted to also mention too, the ramp up time for caseworkers. We didn't touch on that just yet, but the ramp up time for a caseworker is really long. And if they then leave within a year and a half, that's another big deal. But so talk about, Rachel, that when we talk about getting upstream with clients, we're talking about getting upstream with our workers. I know you have some thoughts on that, but also starting with the technology piece. How might we supplement all those creative things that states and localities are doing with technology in order to affect change relative to workforce issues?
Sure. Thanks, Carol. Again, the obvious choice is going to be automation, but not automation in terms of re-automating what we got already, right? So that kind of begs to the whole business process conversation that we're going to get into, I think, a little bit later. But thinking about automation, we're not automating to be fast caseworkers, right? We're not, efficiency, sure, but for what reason, right? So that we can spend more quality time serving families. And so that requires us to rethink the work and kind of shift how we're approaching what we want to automate. What does our system need to look like to support the workforce and support families? I like to use this example, automation, that's the thing, I'm going to go talk BPAR for like 1 second. We don't really know what that means. I didn't know what that meant when I was my first SME gig within the state. I didn't know what SME meant, right? So BPR, that's like, what is that? Well, that's like going to Target pickup. That's a process improvement in our lives. And I'll tell you personally, that saves me time and it saves me money. And so, when you think about automation, a lot of times in social work and human services, we hear, well, all that technology, that does not, replace, or, that's not as good as the face-to-face contact, that, that real deep, authentic engagement with families in their community? Of course not. I'd also say that it's a lot better to go into Target and to, mill through the aisles, right? But I can't always do that. I need to get things done. So same thing, technology really augments those quality, engagements. It's not meant to be a replacement. So we got to think about it that way. And there's tons of things, I'm sure there's plenty of things that can be automated. But again, the potential is far, far beyond that. So I like to also think about the workforce in terms of how they learn and how they are prepared to become workers, caseworkers, even before they ever, hit the agency. So we're talking like back in their early learning environments, like in universities, when they're still, discerning, like, I think I might want to be a social worker, but, it's a lot different at that level than it is when you get your first caseload. So introducing, I'm a huge fan of introducing technology in those environments. So when students and future workers are learning about the types of things that we do to document the work, to assess families, to, to talk about safety and, well-being and all that stuff, we should be using the tools that sort of look like what they might be using in the workforce. And those students, I mean, they're going to tell you that's what they want. They grew up on technology, right? Like they weren't playing with Atari like I was. I mean, they grew up on that stuff. So we need to be attuned to that. And then that carries forward to your pre-service, right? You're using technology for onboarding. You're using technology for as part of their pre-service training, really enhancing that skill development, increasing critical thinking. And then beyond that, just ongoing skill development. I would love to see an agency use a type of sandbox environment or a training environment for ongoing skill development for workers that are seasoned even, just keep using that and do it with the technology. Tie those things together as opposed to how we kind of do that now. Often I see training separate from the technology. And if we're getting Target pickup and, doing, Grubhub and all that stuff, we need to do that in our practice.
Yeah, that's all great. And, the truth is too, like, we don't even need that much training a lot of times, to use the Grubhub app or whatever. It just shows up on your phone and you just use it, right? So
that's a great point. Yes.
Yeah. With the modern, I think we are so, embedded in our traditional approaches, but I also see and have seen in some projects that I've worked on where they implement something really new and great, but they don't explain to the workers how to use it in your daily life, right? Like how do I take this laptop into the home and use it effectively, or my tablet with a family in a way that's not invasive, right? Like that's another thing. Like, okay, you're going to tell me I have to use this thing, but I don't want to, have something that comes between me and the family. So how do I use this in a way that doesn't do that? A lot of the trainings tend to lean toward click this button, use this flow, put this data in, right? Not what are the various ways in which a caseworker might leverage this technology in order to develop and nurture a great relationship with the family that builds trust. And that is possible with the tools that we have available to us today. That was all completely off the cuff there, so sorry.
No, it's great.
Yeah, no, it's exciting topics, right? It's really exciting to think about all of the many ways in which we can use technology to help advance this work. So now let's move to an area that's not as, it's a little trickier, that's a little scarier. A lot of folks, a lot of conversations are going on about equity, inclusion, bias, all of these things. And for some people, they're averse to using technology because, they don't want it to perpetuate bias that already exists. But there's a lot of equity to care, equity, access to services sort of aspects to this issue as well. So Bill, I'm going to ask you to talk a little bit about the various aspects of equity as it pertains to child welfare. And then we can talk a little bit about how does technology help address those issues. So Bill, you want to kick us off?
Sure. Thanks, Carol. So as both you and Rachel have noted, essentially we're talking about meeting people where they are, whether this is in person or virtually. So providing these virtual options for meetings has really made things more flexible and efficient for both caseworkers and families. So these virtual meetings, they don't necessarily replace things like home visits. Those are still going to happen. But of course, could be meetings with your child and family team, your multidisciplinary team, with service providers. I've heard from former colleagues in multiple states that have said families are much more inclined to attend these virtual meetings than in-person meetings. A big reason being they don't have the challenge of having to travel to the office or another location. So it really has increased participation and attendance and engagement. I want to go back to what Rachel had mentioned about one of the biggest issues is providing access to services for both families and youth. We have service deserts in a lot of places and lack information about the types of services that are available. So we see it happening everywhere. So this isn't just limited to rural or remote areas. So if we take high needs children, we're needing to identify treatment or placement options for. If we don't have the right services available, they may go undelivered, or even worse, that child may end up being placed somewhere that could cause or perpetuate trauma. And lastly, another more critical, more sensitive and critical subject, which Carol, you mentioned at the outset, is racism and bias. If we don't have the right systems in place, we're not going to be able to easily figure out where and why this is happening, and we won't be able to address systemic bias appropriately.
Thank you for that, Bill. I really appreciate it. Yeah, it is a big issue and one that needs some candid conversations, right, to continue to address. We're at the tip of the iceberg here on that conversation today, because we know there are some much bigger conversations and that are happening every day, rightfully so. But Rachel, going back to some of your experience, and you've worked on a number of CCWIS projects across the country too, how might technology help to affect some of those areas in a positive way?
Sure. Again, starting with the simplest, access, convenience, piggybacking off of what Bill was saying about, not having families have to necessarily come into the office, and, there's transportation issues, either no transportation or limited transportation, families in rural areas. The other thing that I thought of was it's scary to see first time you got a report and somebody's saying that something happened, right? So that's a way to kind of break the ice and to meet that family, engage them, and give them a little chance to meet us where we are on the other side, right? And to be comfortable in that. But also thinking about it in terms of, again, mobile portal, all that kind of stuff. I keep talking about that, but just alleviating pain points. Talk about alleviating pain points for workers, and that's key, but also thinking about alleviating pain points for families, right? There's a lot of, it's hard to be a parent, and it's certainly hard to be a parent with involvement in a child welfare program and all the things that go along with that. So providing them the ability to have less stress in their journey. I also want to go back to the data conversation. I thought just for a second. So data informed, data is tricky for us because, again, we think, it's skewed or it's this or that, and it does tend to point to things that we know, and it does there's been a lot of stuff, a lot of articles, a lot of press news about, AI and using different types of data tools that can take us in a direction that maybe is a little scary. But I like to think about it more in terms of not data driven, but data informed, and stop talking about data, or actually I shouldn't say stop talking about data. We need to start talking about data with the workforce, the people that knock on doors. So use data in a way that helps them, just understand that it's a story, it's information. And, that data can help us with things like bias. It can help us see across our state, across regions, across pockets, what's happening in terms of bias. And then we can better address that programmatically, and not in a way that's punitive, not in a way that's like, oh, these workers are, making these kinds of decisions, but as a learning tool. So using data in that kind of a way. Yeah, I could think of a lot, but you better stop me.
Yeah. Yeah. And even using that data to inform policy reform, right? Like that's another thing. We know that some of our policies are rooted, in very old thinking, and there certainly are some areas that we need to address. And so I think the data can do a lot to affect change from a policy reform perspective. Before we go ahead and talk about the CCWIS question, we did get one question in the chat that I do want to address. And that was, why do we always breeze over the pay issue? And so I don't want anybody to think I'm breezing over that, because I'm the first to say our caseworkers are not paid nearly enough for the work that they do. And so it was not our intention to breeze over that. I don't know that there's a whole lot that we, the ones who are speaking today, can do to affect that, other than to continue, even in our own jurisdictions, to advocate for, pay reforms for social workers, because I 100% agree with the person that asked that question. How do we do that, right? It's budget, it's legislature, it's all of those things. And part of it may even be, if I wanted to really stretch, if we are able to improve outcomes, if we're able to get more efficient, if we're able to do all of these things. And I have seen some states that have given very significant pay increases to their workers, and kudos to them. I firmly believe that caseworkers should be treated like all first responders and paid appropriately for the very, very important work that they do. So thank you for that question, and accept our apologies. We didn't mean to do that, for sure. So let's roll into the promise of CCWIS, right? When CCWIS first came out, it was all about program and practice and using data. And I was like the biggest cheerleader out there championing the cause. Can't wait for this whole CCWIS thing. It really hasn't gone quite the way that, I was hoping it would. We do have another poll question for those of you who are on a CCWIS journey. Hopefully that'll come up here soon. And just in terms of, where are you? If you've started, if you haven't started, are you in the planning stages? And even those of you that have implemented, right? Because, one of the things I've heard my clients say is, we got to get it right, because we're going to be stuck with this thing for 20 years. And that's not really the way it works anymore, right? And that's why the CCWIS compliance process is sort of what it is. It's an ongoing kind of iterative thing, because you're going to be hopefully updating your system periodically and not waiting 20 years to get modernization. And that's part of this notion of building modular systems, right? And this notion of data sharing, and technology advances so quickly, you don't want to wait 20 years to update your system. So even if you've already implemented, the good news is you're going to constantly, or hopefully, be iterating, adding new things, augmenting that with solutions that will continue to extend your capabilities as program and practice changes, as regulatory things change. So, I think that's one of the things that, I still feel optimistic about. But I'd like to talk, Bill, a little bit. We mentioned this early on about RFPs and how to ask for solutions that support program and practice. Like, a lot of the RFPs come out, they still kind of look like CCWIS RFPs, right? I need intake, investigation, case management, like, right? So how might a state, what might they put into that RFP that would invite innovation, that would invite competition, and that would get back to making a technology investment that has a return on the investment for the program?
Sure, Carol. As someone similar to Rachel, who was a caseworker during the early CCWIS days, and who's since been involved in child welfare modernization projects in several US states, as well as Canadian provinces, I definitely have some opinions on this one. Even before the jurisdictions start to document the RFP and start writing that out, it's really best for their agency to spend some time thinking about what they want to get out of this technology investment from a program standpoint. So that RFP should really be written from that business program perspective, rather than from a specific product, a specific feature that they want. So instead of having the requirements saying, we'll stick with Rachel's example, you want a portal or a mobile tool because they're different, you want to ask for a solution that allows for a client to update their household information on their own. So that's a very specific example, but it really applies to a lot of things. So the example can improve data timeliness, accuracy, it can save caseworkers time, and can help the client feel empowered in creating their own case. I've actually been surprised that states have been slow to adopt the model CCWIS RFP. So that's something that's been advanced by the Casey Foundation over the past several years. And it really takes the approach of starting with those program and policy objectives, which are placing our child welfare outcomes at the center of our CCWIS effort. So rather than having vendors respond to X number of detailed requirements, and we know there may be hundreds or thousands of these within the RFP, the model RFP really spells out the agency's goals for each functional area. Excuse me. It provides any preferences or best practices they want considered. And it also lists out any constraints that the vendors need to be mindful of in their RFP response. So child welfare CUT solution in particular can really take the opportunity to be creative here and show how innovative they can be around these prioritized functions. So imagine if you were to add up to the key performance indicators of all these program-led business requirements, the impact really could be quite profound.
Yeah, for sure. I'm a big fan of that model RFP as well. And so for states out there that, it's hard, right? Because you're still dealing with procurement offices who might want a more traditional RFP. But it doesn't mean that you can't borrow some aspects of the CCWIS model RFP and embed them into what you're developing. So strongly encourage folks to go out and check that out. Rachel, can you give us some other, kind of comments on examples of ways in which technology, doesn't have to dictate a specific solution? And I don't know if we want to, get too deep into it, but just, one of the things I hear from a lot of states is they want to avoid change orders. How might they do that so that, there's not some surprises downstream?
Sure. Well, I'm a firm believer in your first place to go looking is your CFSR and your program improvement plans, which really should map to your agency's policy, your practice model, and your strategic vision, those kinds of things, the things that we talk about, the things that, all the great articles come out in these different, human services, child welfare magazines. We need to be doing that, and we need to be using technology to help us get there. So starting there for me, and I said it earlier, but beginning with the end in mind. So, RFPs are full of requirements, but let's break that down for a second. What if requirements really mean, what do we really need to improve lives, to improve the way the work is done, to improve outcomes for families? It should be hidden in your policy. We hope it should be, well, hopefully not hidden, but it should be within the, those pages within your PIP. And I'm surprised at how many RFPs I have seen in the last many years that don't really go into that level of detail. And, some are very like bullet list and, we need these things. so that again, we talked about the self-assess. I think we talked about the self-assessment tool. I would echo that again. They're really they're very practice oriented to begin with. So you know, that's a great I don't want to say clue, but that's a great tool to use to be crafting an RFP, to be thinking about, you know, what we ask for. Understanding what's available in the market, you know, touching on, you know, we talked about CRMs versus COTS versus what else is out there. You know, I will admittedly say, like, for your workforce, that's, you know, they're less interested in that, but if they understand that they need to tell us what absolutely is not working today and envision what could work better, we need their voice at the table. And an RFP should not be a technology driven document. It shouldn't be a technology or an IT driven project. We got to flip that too, or at least meet in the middle and have, the parallel process for that. And my mind is like child and family teams, right? So everybody has, a place at the table. We have different disciplines, different viewpoints, but we work together to come up with the best plan, just like a case plan. Think of your RFP that way, so that, the vision and the needs of the agency, the worker, and certainly the most importantly, the families, is really what's paramount in that. Yeah, I think I'm just making sure I didn't miss it.
No problem. No problem. We are kind of running a little short on time, but before we jump into the Q&A section, could you just, Rachel, just spend a minute talking about, so we mentioned earlier that Cúram is a COTS product. We talked about what a COTS product is already. Can you just talk a couple of minutes about what are the benefits of a COTS solution over a custom or, a CRM solution? If you could touch on that, please.
Sure. So a COTS solution, we said earlier, is purpose-built, and it's built with the actual work in mind. So it's not something that is, sure, it could be scalable across industries if you wanted it to be, but the functionality, or, I call it the meat and potatoes, that stuff is really geared towards practice improvement. So you're coming at that as a state or a project team with those things already thought through, right? And so there's, generally speaking, that would be less time, lower cost, and quicker to market. But really what that means is getting those tools in the hands of workers so that they can do this work, differently and in a way that families need. So that's COTS. COTS is, I think there's just too many misunderstandings about COTS. We could do a whole webinar on just breaking down what is COTS, what is COTS, what isn't COTS.
Right.
And so that's important. And then, like a CRM, I just want to say this happened to me when the Illinois, and I love this. It's described. We were doing roadshow, our CCWIS planning, and my colleague said, it's like a platform, and everybody's like, what? Think of a green Lego platform, right? And you can put the Legos on that you need, right? Well, a CRM tool is, it may have more Legos than you actually need, so that could be a cost issue. Or you don't know exactly what what color you want your Lego to be, whatever. And so that adds to time and cost. So purpose built, again, it's already, a lot of that guesswork is already done for you. And I'm surprised that, we're just not seeing as many of those, because it's clear that we don't have time on the business side to be, we've got we don't have workload issues, we can't have people engaged, but yet here we are kind of having these things come around again like we did many, many years ago. So.
Well, thank you. Thank you both for your insightful discussion today. It's been such a pleasure, to be able to talk about these topics. I know we've enjoyed planning for this event and, getting opportunity to get on our own individual soapboxes on different things. So that's been fun. We're going to move into the Q&A portion for about 5 minutes, and then Marcy's going to come back and give some parting words. But you have any questions, please use the Q&A tool, and we will be happy to entertain those questions that you might submit. Okay, let's start with this one. Bill, in terms of the RFPs, we'll see some differences in some of the RFPs that are coming out. Can you talk a little bit about any parting words you have for the folks that are about to embark on their CCWIS journey?
Thanks, Carol. I do. And this has been a great conversation today. So I've been glad to be a part of it. So I would say 3 things just quickly for agencies moving forward. So first is change management. As far as engaging your stakeholders. So you get that early buy-in from your key stakeholders, kind of cross-functional areas, representing your central office and your field offices. So these will be the folks that will serve as your change champions in advance of your project initiation and beyond. Second, as we've all touched upon today, business process reengineering. So I'll echo Rachel that agencies need to start looking at their CCWIS journeys less solely as technology implementations and more as kind of business transformation projects. So using a COTS solution that's purpose-built for child welfare, like Cúram, that'll allow the use of the core product functionality as well as the built-in child welfare processes that come, and it really give you a jump off for design. You also want to make sure that your product allows you to localize as opposed to customize. What I mean by that is you're meeting jurisdiction-specific policies and practices more through product configuration rather than having to customize something that new because the product doesn't have a starting point within the product. Last is staffing, both from an agency and from a vendor perspective. So agencies should really identify subject matter experts from their own staff who have knowledge across functional areas. They'll need these folks to be committed to the project, number one, so they don't be distracted from their regular job, but also to have them actively engaged throughout all phases of the project. And agencies should also insist within their RFP that vendors provide key staff that have both child welfare domain and child welfare implementation experience. So folks with backgrounds similar to Rachel, similar to myself, as Rachel noted previously, these are your project staff that would really create that kind of seamless connection between the frontline users and the technology staff. So making sure that things aren't falling through the cracks and aren't getting lost in translation.
Yeah, that's great, Bill. And we actually had a question come in from someone else, and I think, Rachel, you can touch on this too, is what strategies to use. I mean, we've already talked about the workforce is stretched, and now we're saying, but we want them on the project, right? It's tough. So what strategies do we use or recommend to states to articulate that it's not just an IT project? You need to be engaged in the program throughout the life of the project. How do they do that?
Oh, that's hard. But it needs to be done. Well, I would, first of all, I want to echo everything Bill said about stakeholder engagement 1000%. And with that, I think one of the best things you can do, again, recognizing the workforce, issues, is leadership, knighting people that have knowledge, historical knowledge of the agency, all the policies, all that good stuff, that can be your decision makers, that can be very zeroed in on what's happening in terms of, we've gone beyond the RFP, that's out, we've decided. You want those people engaged and making decisions, because leadership doesn't have time to do that, right? I mean, and they're at that 1,000-foot level all the time trying to run the whole agency. So recognizing that you're going to have you know, varying levels of staff. You've got subject matter experts and people that perform in like BA type roles and, you know, your testing and all of that, but you need people that can be your decision makers for leadership and can kind of, you know, filter that information and decision making across the different divisions, because you know, we sometimes think linearly, it's like intake, investigation, and da 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 da. But you got to be thinking about those cross, you know, cutting processes in those divisions all the way throughout from intake, right? And I think that is something else that sometimes we don't always think about. So that's a hard one because it's like, yeah, you literally just told us that we just need the right kind of worker. We already the right kind of person. We already know that. Yeah.
Yeah, it is tough and we get it. But not doing it, I think, is more problematic and painful than finding a way to make it happen. We did get one other comment in the chat there that I do want to mention, and that is, yes, off the shelf is great, but you have to be careful what you choose. You need to choose a solution. In this particular case, the person that posted this chose a product that didn't allow them to configure it to meet their business needs. So when you're writing that RFP, think about that. What are the things that you may need to configure? And put that in the RFP, and then measure against that when you're doing your evaluation criteria, when you're reviewing the proposals and you're, you know, inviting vendors in to oral presentations. Put some due diligence around what are the things that you really think may need to change in the future. And that applies not just to COTS, but CRMs as well, right? I've been on other projects where we bumped into that, and even something as simple as changing rates for a provider every year ended up having to be a custom code situation. So think about what are the things that you think are going to change. Try to be a little forward thinking. You're not going to get everything, but you know, putting some time into, you know, articulating that and contracting for that.
Can I just add to that, Carol, really quick?
Yeah.
I would not shy away from asking very specific questions in addition to your, you know, your requirements. Tell me what your solution can do for, you know, how does it support youth permanency? Or tell me exactly how your solution empowers families or enables families to be part of their case planning. How do they get into the system? How do they, you know, ask you can ask that specific stuff, and that we really should be. And that's a good indication of how well that's aligned to child welfare in terms of kind of what you might get back in your responses. So I would also say that.
Yeah, absolutely. Thanks for sharing that, Rachel.
Sure.
Thank you again, Bill and Rachel. We are definitely running out of time here. Probably because at the beginning, before everyone joined, I said we would have plenty of time, not to worry. But so I'll ask Marcy to come back on now and give us some closing remarks, and then Alex from APHSA will close us out.
Thank you so much, Carol, and thank you, Rachel and Bill. Just an amazing conversation about the challenges child welfare professionals are facing, but also very uplifting in how technology can be part of that solution going forward. I thought you all did just such an amazing job offering advice on RFP processes, implementation processes, and things to think about as counties and states go forward looking to how to improve their and how to modernize child welfare in their areas. So thank you all for your insights. I hope everyone found the conversation useful. We would love to continue the conversation with you at the upcoming ISM conference. We've brought that up. Several of us have brought that up, and we'll be there September 10th through 13th. Curative by Merative does have a booth, 509, and would love to just continue the conversation with you there of your strategies, your goals, and any insights you had from this conference. Would love to pick that conversation up. We have a link here, marketinginfo@merative.com. If you have additional questions for us that we can answer, please reach out to us. We're happy to reply to you electronically from that forum. Thank you again for joining. I'm going to turn this over to Alex from APHSA to close this out.
Thank you, Marcy. On behalf of APHSA, I want to thank our panelists for their contributions on the subject. I'd also like to thank those in attendance for the questions and contributions as well. I want to remind you to register for our ISM PHSA conference September that Marcy mentioned, as well as the other panelists mentioned. I also want to remind you that this webinar will be available and shared within the next few days. Look out for that email and have a wonderful day.